Diabetes, as definition, it is considered to be a disease in which the body's ability to produce or respond to hormone insulin is impaired, resulting in an abnormal metabolism of carbohydrates and elevated levels of glucose in the blood. Okay, so most of the diabetes that we see maybe in day-to-day practice will be more related to type 2 diabetes, and it is said that about 90% of most of the diabetes cases belong to type 2 and the remaining fall into the type 1 category. So predominantly we might be seeing today about type 2 diabetes with little emphasis about the important elements related to type 1 and the various other types of diabetes. Okay, so let's see what are the causes for diabetes. All right, the statistics say that diabetes per se, the broader classification of the causative factors falls into these 2 points. That is, it either could be a genetic predisposition, that means something that is running in the family, maybe your father, your mother, or the patient's siblings might be having diabetes and it runs in the family as a genetic disposition, or it could be because of physical inactivity, being overweight, which can also be a contributing factor towards insulin resistance. As I said, any insulin resistance, any insulin sensitivity is definitely going to cause a hyperglycemia followed by diabetes. What are the types of diabetes that we are seeing nowadays? The common ones being type 1 diabetes that you might come across, type 2 diabetes, or maybe a pre-diabetes, or it could be drug or chemical induced diabetes, or post-procedural diabetes, or it could be because of post-pancreatectomy, or it could be a secondary kind of a diabetes. All right. So type 1 diabetes is a chronic condition wherein the pancreas is producing less or absolutely no insulin. The type 2 diabetes, here the body either is not producing enough insulin or it is resisting the insulin production. That could be the reason. The third type, that is the pre-diabetes, is a condition in which the blood sugar is extremely high, but not high enough that we can diagnose them or classify them under type 2 diabetes. Maybe over the period of time, over a period of years, it is said that it is likely to become type 2 kind of a diabetes. Then you have gestational diabetes, again a form of high blood sugar level affecting pregnant women. In most of the cases post delivery, the sugars might fall down, and it is also seen that such women in future uh, might get classified under type 2 kind of a diabetes. All right. Then you have drug or chemical induced diabetes, especially patients who are on antipsychotics and antihypertensive. It is seen, the studies show that these people also have got, or rather these medications can be a precipitating factor to diabetes as well. Then post procedural diabetes. Now these kind of diabetes are those that are caused because of certain stress that might develop after a surgery or during the surgery. We know how much anxious the patients are during surgery, so the anxiety and the stress level can cause a release of certain hormones like the catecholamines, or which are the neurotransmitters that might be released into the bloodstream, because of which there could be an insulin resistance leading to a lack of sensitivity to normal levels of insulin. All right. So this could be one of the factors also for a person present to you with diabetes. Or it could be because of removal of pancreas, or it could be because of secondary diabetes. Now again, secondary diabetes means diseases of the pancreas that destroy the pancreatic beta cells. For example, diseases like hemochromatosis or a pancreatitis or a cystic fibrosis or any kind of malignancies related to that affect the pancreas can also cause the development of diabetes in a patient. So these are broadly the different kinds of classification of diabetes. You see this picture, it will give you an overall view of what are the diabetic complications a patient can come with. Therefore, you can expect almost all the organs of the body being affected if the patient is not, or rather is not on a controlled diabetes. So let's see what are the complications. The complications could be maybe it could be a retinopathy. If it is related to the eyes, it might come to you with a retinopathy. It can affect the heart. All right. It can affect the kidneys, can cause a diabetic nephropathy. It can affect your GI systems, all right, leading to a constipation. If the nerves are being affected, probably a patient might present to you with an erectile dysfunction, or he might present to you with a peripheral neuropathy. Or if the cardiovascular system is affected, say for example because of diabetes, if he has gone into complications of atherosclerosis, all right, so or the patient might even present to you with an orthostatic hypotension as well, all right. So it can affect the urinary system, where the patient can present to difficulty in retaining urine, or frequency of urination, or maybe the chronic glomerulonephritis can be a complication. And obviously cannot ignore, over the period the patient might develop a chronic kidney disease as well, going into dialysis. The symptoms could be the 4 P's that are very, very important when we talk about diabetes. That is, the patient might present to you with a polydipsia, with a polyuria, or polyphagia, or paresthesia. All right. Associated with it, the patient might even complain of having fatigue, or if the eyes are affected, he might come to you with a blurred vision, okay, or he might come to you with polyuria, and because of polyuria he might present to you with various infections. It could be urinary infections, or it could be infections related to maybe a diabetic foot, or it could be some kind of a septicemia that the patient is presenting to you with. All right, so these can be some of the common symptoms that the patient can present to you with. Obviously, without doubt, we have to also understand that most of the diabetic patients could be obese. So overweight and increased BMI could also be one of the commonest presenting feature of a diabetic patient. We were discussing about the different types of diabetes in the beginning, and I had told you about the type 1 and type 2 diabetes. All right, so let me just give you the difference between these two kinds of diabetes as well. All right, now if you look at this presentation, it will give you a clear differentiation between the two types of diabetes. The type 1 diabetes usually affects the younger age group. Okay, usually it is seen after maybe from 6 to 10 years of age, the child might start presenting the complaints of diabetes. All right, so younger age groups are more prevalent to type 1 diabetes, whereas the type 2 diabetes is more prevalent in the middle age and the elderly population. They say after the age of 40, people are highly or likely to develop type 2 diabetes. All right. Now, in type 1 diabetes, the patient may not be obese, unlike in type 2 diabetes. So, obviously, they might come to you with a normal BMI, whereas in type 2 diabetes, since they are overweight and obese, obviously their BMI is going to be on the higher side. There may or may not be any immediate family history in type 1 diabetes, but definitely when it comes to type 2, most of the times we find that there is a family history of diabetes running genetically. So in the beginning of the slide itself, we had discussed that genetic predisposition is one of the main etiological factors towards development of diabetes. All right. Then in type 1 diabetes, the complaints or the symptoms are of shorter duration, maybe for weeks, okay, whereas in case of type 2 diabetes, it might be there for months and for years as well. The patient in case of type 1 commonly go into diabetic ketoacidosis in type 2, but they might present to you with a diabetic coma, or the other complications that we discussed just few minutes back, that is we are talking about the diabetic foot, and then maybe they might come to you with the retinopathies and glaucomas and cataracts. These can be the complications that they could present with. All right, so because there is a point about diabetic ketoacidosis, I'm sure we know what is diabetic ketoacidosis. So diabetic ketoacidosis is nothing but when the insulin levels are falling short and the blood sugar is not being able to be processed in the cells, or are not being or are unable to be taken in by the cells. What happens? There is a response that is triggered to the liver, wherein it starts releasing ketones into the bloodstream, and these ketones, which ideally should be excreted, when they start building up in the body, it increases the acid level of the blood, and that can lead to irritation in the body, different organs of the body, and the patient might present to you with a ketoacidosis, and this ketoacidosis is considered to be a dangerous condition where if not corrected on time, if proper fluid replacement and proper electrolyte imbalance is not corrected, the patient might also end up uh, into death as well. Okay, so that becomes an important factor. And how do you recognize a patient with diabetic ketoacidosis? One of the classical sign is Kussmaul's respiration. Kussmaul's respiration, that is a labored breathing that happens in case of diabetic ketoacidosis because of high acid levels in the blood. Going forward, obviously, when it comes to management in type 1 diabetes, which we will also discuss later on, insulin will be required because there is a deficiency of insulin production in the body. So, you have to give insulin externally to manage the sugar levels. And in type 2 diabetes, insulin may not be the primary mode of treatment. Patient might be asked to first manage his diet and lifestyle, try to reduce weight, and then if maybe put on oral anti-diabetics, and if required, if it does not improve, that insulin will be the last resort for such patients. So this is just a general differentiation between type 1 and type 2. The common risk factors include a family history of diabetes or some kind of cardiovascular diseases, all right, can also, like dyslipidemia, can cause or can lead into diabetes as well, because these fat are the increased deposition of fat in the blood vessels or collection in the blood can lead to decreased sensitivity towards insulin. So, the insulin resistance here or sensitivity towards insulin is decreased, because of which the patient might develop high sugar levels in the blood, leading to diabetes. Okay. The other risk factors, obviously the age, older age groups have got higher chances of getting diabetes. Then hypertension can be one of the factors that could be the reason or that could complicate into diabetes. High blood pressure, because we know that high blood pressure has got an indirect effect on the kidneys as well and the different organs of the body. Okay, so that can be one of the risk factors as well. Obviously, physical inactivity, people with sedentary lifestyle and lack of physical activity can also present to you with diabetes. Other reasons we've already discussed: gestational diabetes, polycystic ovaries could be another risk factor. Teenage girls with PCODs can in future uh, present to you with diabetes as well. So let's see what are the things that you want to investigate. Obviously, the HbA1c levels is extremely important level, uh, and this should be if you want to diagnose a patient as to be diabetic, then your HbA1c level should be more than 6.5%. Okay, and this is an important test that will give you the understanding or the idea of the average glucose in the blood over a period of 2 to 3 months. Then you will obviously do the fasting plasma glucose level. Okay, the fasting level should be somewhere less than 140 for a normal person, and more than that would be obviously diabetes. Okay, random blood glucose, again a very important element. Most of the one of the common investigation that the physician might do, a random blood glucose level which should be more than 200 for you to term a person to be diabetic. Okay, then obviously a 2-hour post load glucose can be done. Oral glucose tolerance test can be done. You might want to go ahead and check for the lipid profile. Okay, since we say that insulin deficiency or resistance or insensitivity, whatever you call it, is also indirectly affecting the liver, and so therefore a lipid profile becomes extremely important as well to check the health status of the patient. Then you might want to go and do a urine analysis, want to check for urine ketones. All right, you want to check for the urine albumin or creatinine levels. Fundal examination, very very important. So every visit, it is very very essential for a person who is diabetic or who is prone to diabetes, to the patient the doctor would always recommend the patient to regularly follow up with his ophthalmologist, because the eyes are one of the very sensitive organs that get affected in case of diabetes. Diabetic retinopathy is one of the very common complications that the patients will present to you with in cases of uncontrolled sugar levels. Okay, so glaucoma, cataract, these are some complications that are very, very common, because if the damage is already done in the eyes, it's difficult to revert them, and therefore it is very important that on regular basis the changes that happen are taken care of, and sugar is monitored and kept in control from that perspective. There could be numbness and tingling. Okay, so you might want to go ahead and check for these things to know the status of your nervous system, whether the nerves are functioning properly or not. High glucose is known to affect and damage the nerve endings, okay, nerve cells. Again, something that cannot be regenerated if not taken care on time. Then foot exam is done to know if there are any foot ulcers, any injuries, any non-healing ulcers. Okay, because in diabetics, since there is no pain, even if they have an injury, they may not they may not know about it, and that injury might remain and form an ulcer, and there could be infections. Okay, it's very difficult to manage infections. So therefore, a foot examination is very, very important to rule out any kind of complications related to that. Okay, then you have the physician might want to check the glomerular filtrate rate to know the functioning of the kidneys, how good they are, how is the excretion, whether the kidneys are functioning well or not. And then a urine analysis for proteinuria, albuminuria. Okay, in people who are diabetic, glomerulonephritis is a common complication. Okay, nephrotic syndrome is a common complication. Uh, Chronic kidney diseases are there. So in these things, we know that the glomerulus is affected, and therefore the filtration is affected over there. Okay, so it's the protein that should be absorbed into the system is thrown out in the urine. So depending upon the amount of albumin or protein found in the urine, we can have an understanding of how well the kidneys are functioning. The higher the amount of proteinuria, the worse is the status of the kidneys, is what we can understand. All right. Now, diabetes management is going to be based on these 5 factors. Okay. First is your blood glucose monitoring. We've already discussed what are the normal levels. Okay. So, a regular blood glucose monitoring is the essential element of a diabetes management. The diet, obviously, there should not be any carbs in your diet. Fat should not be there in your diet. Okay, it is important for the patient to be told about what kind of fats are important. A fat that is rich in food that is rich in HDL is more recommended rather than food having triglycerides or high level of LDL. So such foods have to be ignored. We cannot completely neglect or stop the carbs, but we have to ensure that the complex carbs are more recommended rather than the easy carbs. Okay, which can lead to a increase in the blood sugar level. So complex carbs is fine. Like for example, instead of a white bread, going for a brown bread, because brown bread takes more time in breaking down, and white bread contains carbohydrates that can easily be broken down, and they start getting accumulated in the blood, and therefore it is dangerous. Then exercise, yoga to relieve your stress, exercises like running, or the doctor will discuss about what kinds of exercise, maybe cycling. These things can be done to ensure that the energy utilization of the glucose is done properly in the body. Counting of carbohydrates. Now again, that also will come as a part of your diet plan, counting the carbs and eating. So once these things are in place, most of the time the people will show a decrease or fall in the blood sugar levels. Okay, especially in type 2 diabetes, immediately as soon as the patient is diagnosed, you will not immediately the doctor will not put the patient on insulin or anti-diabetics. He will first would want to ensure that these areas are corrected, and these modifications are done, and the patient is following those modifications. Most of the time the patient is able to control the sugars with these basic modifications. But in cases of patients who are not, whose blood sugar levels are not coming in control in spite of all these things, that's when you will bring in the medication part. In case of type 2 diabetes, insulin will be the last option suggested to the patient, and in type 1 diabetes, insulin becomes the primary mode of recommendation. Okay, so these are the important elements in cases of diabetes management.